Hi everyone, welcome to another show of Connect Me with Rosemary. In today's show, we will be talking about what's next after being diagnosed with cancer. So today we have two guests, and they are Gina Fogg, who is the financial caseworker at the George Cancer Center and also a certified application counselor. And we have Ann Proctor, who is a nurse from WellSpan Health, Manager of Oncology, Outpatient and Clinical Services. Welcome.
Thank you.
Thank you for being here with us.
Thank you.
So I'm very happy, and this is our first live here at White Rose TV. And also you can find us live on Facebook on our page, Connect with Rosemary. All right, so Gina, what is your role at WellSpan?
My role is I'm a financial caseworker at York Cancer Center, and what I do is I assist patients with getting insurance. I assist them with their financial needs. I do a little bit of everything as far as helping the patients after they get the diagnosis.
How about you, Ann?
I'm the manager of oncology outpatient clinical services, which is kind of a jack of all trades, I would say, master of none, possibly. I want to ensure that the patients have the same experience from one cancer center to the other, so we do a lot of consolidation of services and also standardization of things so patients can expect the same care, excellent care that we provide.
That's very nice. So how our audience can get in contact with you, Gina?
You can get in contact with me by calling York Cancer Center. Our number is 717-741-8100. And that's our main number.
Your main number.
Yes.
Okay, how about you, Ann?
It would be the same number, yes.
So you are located in the same
I'm
building.
located in the same building, yes.
Okay, so I have another question. If a patient doesn't have health insurance, can they still get treatment?
Yes, they can. They can. We help them with different options. If they don't have insurance, I try to get them insured either with medical assistance, healthy care card, or the marketplace. So I would do all that kind of research for the patient.
Okay, so with the healthy care card, that's something else that we can talk in another show. But then you have the applications right there at your office?
Yes, I do.
And you refer them to the different organizations in the area?
Yes.
If they need help.
If they need help.
So do you have anything to do with that part?
No, I let Gina do her magic.
Okay, so that's good to know. So in other words, if they don't have insurance, they can be free to go to your office, to schedule an appointment to go to your office, and then you can help them to go through the whole ordeal of getting insurance.
Yes.
Okay, so that's good. That's good to know. How about if a patient needs transportation? How do you deal with that? Do you have any programs in the area?
Well, that's
Do you
usually
refer them?
referred to the American Cancer Society, so they take care of the transportation issues and things like that. So
Who is it?
American Cancer
Okay, so
Society, so they would take care of that.
do you refer them there? Or they have to call that particular place?
They can call them
Uh-huh.
if they have transportation issues.
Oh, okay. Is that something that you work with also, or no?
That's the same program.
The same
we work
program.
with the same programs, yes.
Okay. Who is in the WellSpan Cancer Treatment Team?
Okay. There are, we have a support team that includes Gina as a financial counselor. We have social workers, we have dietitians, we have nurse navigators, and then of course our physicians and nursing staff with infusion and radiation.
So all of them work with
All
the
of them work
patient
with the patient directly.
after he's diagnosed with cancer. So how is the approach to the patient when they're going to be diagnosed?
It's really a multidisciplinary approach. We have, the physician is the director of the care,
Okay.
and they create the plan for the patient, whether it's surgery, chemotherapy, radiation, or one or all of those. And once a patient is diagnosed, they are offered the services of the York Cancer Center, so they have the ability to, per their need or per their request, to see a dietitian, see a social worker, Gina, or a nurse navigator. We do have one dedicated breast cancer nurse navigator who works with our breast cancer patients, and then we have another nurse navigator who works directly with lung cancer patients, head and neck cancer patients, and some of the other GI cancers. So anybody who especially needs help navigating the system, because the cancer journey is very complicated, as most people know. It's a very complicated journey, so sometimes it's hard to understand. They won't make decisions for people, but they'll support them and give them the information they need to make an informed decision.
That first phone call to let them know they have cancer. I mean, how do you guys approach that? How do you
Well, we would certainly hope that it's not given over the phone, that we ask the patient, the physician would ask the patient to come to the office. And many times they will ask the nurse navigators to come as well to give the support. For example, with the breast cancer patients, many times the nurse navigator is there when they give the diagnosis, so then she can meet and help direct the decision making that needs to be made.
Do you guys tell the person to come by itself, or they?
We would encourage family support if there's people out there, because it is a life-changing diagnosis, and so you need to have support, and we need to also know what support is there for the patient. I mean, as Gina knows as well, we need to know who is there and available for the patient, because it is a family journey.
Yeah. What question they should ask the doctor after they are there at the office? What do you can tell us?
I think what are my options? What are the plans? What's the plan? What's the options? Should I get a second opinion? Is that something that I should think about? I think those are the just first two things. What's available to me, and what are my options for second opinion?
Do you think it's a good idea for them to go to the internet and research?
I think you have to be very, very, very careful with the internet, because there's so many things out there and so many opinions. Not that there aren't some very good websites, but the other thing is we places like the American Cancer Society, national organizations, I would steer directly to them. I would avoid very unknown sources, because you can get some misinformation.
So after they find out they have cancer, can they call you guys again to schedule an appointment to talk about any other questions?
Absolutely. When you call the cancer center, they get a little information and can direct the person to the right person that can help them. Right.
Do you also give handouts to the patients after they're diagnosed with?
They do. The navigators and everybody gives whatever handouts we have available. We have many at the York Cancer Center as well, that they can walk in and get handouts there. The offices are medical oncology, radiation oncology. We have a lot of teaching resources available.
So you guys have classes available, or there's some support groups?
There are support groups in the community. We have a head and neck cancer support group that meets the second Wednesday, I believe, of the month.
What is that called?
It's a head and neck support group.
Okay.
And if someone wants information, they can just call the York Cancer Center, and they can be directed to when it is.
So that would be one group.
One group.
There are other groups?
That one is sponsored by York Cancer Center.
Okay.
All of our cancer centers have individual support groups. So like Ephrata Cancer Center, Sackler Family Cancer Center in Lebanon, Adams in Adams. The only other, we do have two breast cancer support groups. PINK sponsors one, and there's another for cancer survivors.
Okay.
They were not sponsored by WellSpan, but they can always call the York Cancer Center for information.
Okay. How about if there are no support groups in the area? How families can get involved if they want to take care for the patient? How?
Well, I would look at the WellSpan network, because we cover 4 county areas, so there may be something at another hospital or in Lancaster or Lebanon that they could hook up with or find out. And again, the American Cancer Society has support groups as well, or can direct people to where there are. It's a hard time for support groups, because people do get a lot of information from the internet
Okay.
and get support from that. So it's kind of, people are busy, and
Yeah.
support groups are wonderful avenues, but sometimes it's hard to find the appropriate one.
Yeah, because sometimes families, they don't know where to start. They
Right,
don't know
right.
where to go.
Right.
So at least they know where to go now.
Right.
To call you.
Call the York Cancer Center to get help.
Your cancer center. That's good. So, there's anything else that you can tell the audience about? I mean, to the families. I mean, besides the support groups, there's anything else they could do? To get involved with the patient. I mean, because sometimes they don't know how to start, where to go, or
I think just be present.
be
Mhm.
present.
Just be present. Go to the appointments with the person. Just be supportive. Just be there for the patient.
Well, I can tell you.
You
I know. So I can tell you that mentally it's very difficult. It's a difficult time because I am a cancer survivor. So I could tell you that my experience is that even though I work on the medical field,
doesn't mean.
at the moment I got the diagnosis, I was in blank. I didn't know what to do, where to go. I had all these questions in my head. Will I die? How much time I have left? I don't know what to do next. How I'm going to tell my family, how? I mean, what I'm going to tell them? They're going to panic as soon as they hear that. So at least in my situation, as soon as I got the news, first I wasn't by myself. I was with someone else. This other person took, information for me because I couldn't talk. So the person was there asking questions for me. Even though I work in the medical
Doesn't
field.
matter.
It doesn't matter.
matter.
Doesn't matter. Also, how do I tell my husband? He wasn't there. I mean, I was thinking, how is he going to react? How my daughters and sons are going to react when I tell them. I mean, because if they get panic, I will get panic again. I mean, I had to be calm to tell them in order for me not to get that reaction back.
Right.
Right.
So what I did was I spoke to my husband first. I told him, and I immediately got support from him. He said everything is going to be fine, even though he didn't know what was happening. He told me those words: everything is going to be fine. So I calmed down.
Okay.
Later on, I started calling my daughters, and I told them. I told the first daughter what happened to me, and she was in panic, and I said, calm down, everything is going to be fine,
Yeah.
blah, blah, blah. So I prepared her to call my other daughter,
That's
So
tough.
we did like
Yes.
a
Like a
chain,
chain.
like a
Chain.
chain, and then we give support to the second daughter, and so on. So that helped me not to get that burden of everybody asking me, the same questions I have.
One suggestion for families too is especially if you have a large family, is if there can be a spokesperson for the family, for even family members to call and ask questions, or even the medical providers. It's sometimes difficult when there's a lot of people trying to get information, and we know that there's privacy concerns with that as well. So if someone can have a spokesperson that they can take the information and relay it to others rather than having a lot of people call and things, that can be helpful for a
Now,
family as well.
you talk about something important, HIPAA.
Mm-hmm.
It would be nice to let the audience know a little bit how that works.
HIPAA it's privacy. In other words, when you enter a hospital or an office, they cannot give out any information to anyone. I can't call and say, my brother, for example, I can't call and ask for information. He has to give permission and say it's okay for my sister to get information. It protects a person's simple privacy, and it gives the choice to the patient. Who do you want information to? You're in control of your health and your information. Who do you want to share this with?
So they're supposed to sign some documents,
They do
right?
sign documents when they come into the office and into appointments that, and then they do relay that information to, and it's in the record who they can give information to.
So they are supposed to do that in every doctor's office they go?
Well,
or just
it's
the one.
in-
The information is shared?
It's shared and with, in the medical record itself. So if the medical record is shared within WellSpan, then that information will be available.
And right now, I know that we're working with Epic.
That's right. We're converting, it's a good time to say we're converting to one electronic health record. So wherever you go in the WellSpan health system, your information will be readily available and readily there. So a lot of repeat stuff won't happen. From one office to another, they can pull that up and say, oh, yes, I can call or I can give information to so-and-so.
They don't have to sign any documents
They
to get
do
the information
sign,
shared?
they do, they're kind of, we're going through some decisions about how often that needs to be signed right now. So there'll be more information coming on that. There's not quite, the system isn't quite in place yet. We're making some decisions how to streamline that for the patient, so.
And also in the record, they're supposed to write who they want, who's the person at the family who they want to share the information with.
That's
like,
correct.
if you make a phone call, you have a list of the family members, right?
Exactly, and the list is there, so if I need to call a patient and tell them they need to make an appointment, I know that if, say, Susie answers the phone and she's not on the list, I'm not gonna give her information. So
Okay.
it's patients are very protected,
And doesn't matter if it is the husband or wife.
right, right, it has to be,
It has to be in writing.
right, it has
Okay.
to be directed,
Uh-huh.
yeah.
Direct.
Directed by the patient.
Uh-huh.
The
directed by
patient
the
is in
patient.
charge,
Uh-huh.
yes.
Okay. So there are some other documents. It's called the direct. If something happened with the patient, what is that called?
When someone would, like a DNR, like a advanced directive.
Yeah.
Advanced directive.
Yes. Those
So-
are things that the provider should be talking about with the patient, directing, and there are a lot of organizations and things, information on the internet as well. And not bad information, it's good that if something happens, if you can't make a decision for yourself, who is your power of attorney for medical care? What do you want done? Do you want to be given antibiotics, or do you want to be on life support? There's a lot of, but it's an informed decision, so that has to be a very, very concentrated discussion with the patient and the provider and the family.
Now, WellSpan has My WellSpan.
Yes, they do.
So the person can just get on the internet and sign up,
Mm-hmm.
and then they can get all the records right
Well,
there.
and you can get, if you go to your physician, then they will show you your lab results, your imaging results, the notes from the provider,
Mm-hmm.
kind of your discharge, if you will, from the office, what instructions are there.
It's very good.
Follow up, it is wonderful.
Also,
Um,
they can schedule appointments,
You can
right?
schedule appointments, certain places, yes. Mhm.
Certain places.
Mhm.
No, good.
It's a very nice option for people, yeah.
Yeah. So WellSpan has wonderful classes, programs available for everybody. They don't only need to ask.
They need to ask.
Mhm.
That is absolutely
Yes.
correct. And we will help them as best as we can and try to give them the best experience we can.
Good. I have another question. Do you know of any programs available to help the patient with the financial burden? I think that's Gina.
That's Gina's end.
You know, when the person, as I know with cancer, the person has so many treatments, and all of a sudden, boom, the job. Lost the job and have no income. And how do you guys deal with that situation?
Well, what I do is when I interview the patient, I just, talk to them about what's going on, and they tell me, and I just sort of help them, guide them to different options that they can use. We do, of course, have options, but that's something that a committee meets and we decide on, what the needs are of the patient and how we can help the patient.
So, can you help them to apply for medical assistance?
Yes.
Right there at the office?
Yes, I do that.
Online?
Mm-hmm.
Okay. Do you have the Healthy Care Card
Yes, I do.
application also? So
Mhm.
you can give it to them right there. That's another
Yes.
show that we're going
Right.
to do. That's another show that we're going to be talking about health insurance. So what other programs WellSpan has for those patients who has cancer? I remember visiting you and you show us the pantry.
Right, we do have a food pantry. You know, it's for our patients that are in active treatment that they would be able to come and utilize. We do have that option. You know, like I said, it's just the steps that patients go through as we guide them. You know, so we just let patients know what is available. When they talk to me, I normally do, or we have a social worker that, you know, lets them know what we have available to help them with.
Yeah. Do you have any experience, anything, an anecdote that you want to share of someone, without saying the name, of someone that was in panic and they didn't know what to do, and you helped them going through all that?
I help a lot of patients, actually. I'll just use an example of I had a patient who did not live in the area but was living in the area at the time. I met her and her daughter, and she was diagnosed with cancer. And I noticed that her income was very, very low. And I basically said, you know, why don't you have medical assistance? And her daughter said, well, they just asked us about, you know, applying for food stamps. But what I did was get her medical assistance and, you know, help them that way. And they love me now, so.
Okay. So that's good to know.
Yeah, it
That
is.
I think another thing is,
Uh-huh.
you know, the medical oncologist office also have financial counselors as well. So when people are given the option for treatment, they need to discuss with them what the cost is, and the patients need to be very upfront, asking how much is this going to cost? Will my insurance cover if they have insurance? How can the office help me navigate as well? Because some of the drug companies do have programs for people with limited income to help them get the drugs that they need, and the provider offices would know that.
Well, in my experience, I could tell you that some clients, patients, they don't want to do any treatments until they get some kind of help. What would you say about that? I don't think it's a good idea to wait so long to get help, even though we understand that there's a financial burden and they don't
Right.
know what to do, where
Well,
to
I
go,
think
how
being
they're going to
upfront-
pay it.
Being upfront with the physician and saying, you know, I need to talk to someone and find out what the cost is, what my choices are, what is out there to help me. You
Yeah.
know, I think some of that burden is on the patient they need to ask.
That's right. Because they have like a treatment plan and they have some appointments, and all of a sudden they stop.
Right.
So what will happen is they stop.
They stop.
If they
And
stop, then
unfortunately, you know, if they don't reach out to us or reach out to the physician's office and say, I need to have I have questions about the financial piece of this treatment. You know, if we don't know they're out there,
And
we
then-
can't help them.
yeah.
Yeah.
So I mean, it's difficult.
It is difficult.
It's
It is.
difficult.
It is. And
So
it's
They should have
life-changing.
someone in the family or so to give them that kind of support, because the person is going through so much
Right.
that they cannot absorb all this information at once, and they're scared.
Right.
You know,
Correct.
Or a friend or someone in their community. Not everybody has
that's
Somebody.
family or
Uh-huh.
close. So friends, church people, you know, just neighbors who are there if they trust, that they can.
that's a good thing. Neighbors.
Yeah, that they can actually. Sometimes
Neighbors.
Sometimes people do
better,
have
yeah.
neighbors
Mm-hmm.
that they trust and, you know, want them to come in with them and talk, so.
We should.
Yeah.
We all should. You know what I mean? Because they are the closest family to us.
Right.
You know.
Family is defined in a lot of
Defi-
different ways.
Family-
It
yes.
is. It
Yeah,
is.
it is.
It is.
Yes, it is. There is anything else, Anne, that you would like to add?
No,
With the
think
audience.
we again want to provide the best care that we can. We just need people to be upfront and ask the questions.
I have another question.
Yeah.
Sometimes, and you are a nurse, sometimes people
Yeah, I am.
people say, "Can I take these vitamins and all this?" You know.
Yeah, you have to be very careful when you're on treatment, what
Mhm.
kind of other things. And again, it's asking the provider. We have good reference materials that we can research, and we have the pharmacies available.
Mhm.
They could even ask pharmacists at their local pharmacy, is this okay to take with this medicine?
Yeah.
You have to be very, very careful because there's a lot of vitamins that interact with treatment.
Okay.
So again, not taking anything without asking.
Without asking.
Yeah.
There is a dietitian involved in the treatment team.
Yes, we have 2 dietitians at the York Cancer Center, and actually all of our cancer centers have dietitians available to meet with the patient, and they do a wonderful job of trying to keep nutrition and their nutritional status at a good spot, because once you start losing protein and all of that, it's hard to get back. So it's very, very, especially with some of the harder treatments like head and neck cancer patients, it's very hard to get back what you lose. So it's very important to be nutritionally sound and to eat healthy. All of us should eat healthy all the time, but especially going through cancer treatment. And there's some treatments that some of the side effects may give you metallic taste or give you lack of appetite. So how do we get people to eat and get your bang for your buck when you're eating? Yes. They're wonderful at that. They really provide a great service. And that head and neck support group, they have speakers come in, they have chat sessions.
Okay.
They've had a dentist come in and talk about dental care, because that's also very important with cancer treatment as well. Making sure that, because some of the medicines affect the jaw or the teeth. So, yeah.
Well, I have another question.
Okay.
You answer if you can. If not, you don't say anything.
Okay.
When I was getting ready to get my radiation treatment, and I went to the cancer doctor, and he gave me a list of things I should not eat. I'm from Puerto Rico, and we eat, different fruit from you guys.
You eat some good food.
I said, I cannot eat what I like anymore, like milk and so on. I told the doctor, can you tell me what can I eat? Because I don't know what to eat.
Right.
And it's difficult, because I was hungry all the time.
Yeah.
I was hungry all the time. And they said, go be with me, because if not, I will lose it. I will lose it.
Right.
And then I needed to have my iodine level low for the
Right.
treatment.
Right.
So I bet the dietitians will be able
They
to.
would be a great source of information. That's their specialty. That's what they are trained in. And I even think as nurses, I don't know what they know. They can direct people to what is, and sometimes it's only for the length of the treatment too. As nurses, I've always told people, try not to eat your favorite things during treatment, only because sometimes it sours you to what tastes good. So if you really like pasta, maybe stay away from that during treatment, because you might get a bad taste or flavor from it and not like it later. So, some of the things. Metallic taste is also very hard, so people can use plastic utensils to help with that. And the other big thing is just keep hydrated. Water, water, water. Just keep drinking. People can get really dehydrated when on treatment, so it's really important to drink.
Yeah.
But consult the dietitians.
Yeah.
Yeah.
Good. I understand. It's my understanding that now WellSpan is involved with Hopkins. John Hopkins.
We have an agreement with a collaborative agreement that we can have a certain amount of patients we can send down for second opinion, have a little bit faster track. We can get education sources from them up to help teach our physicians and our nurses. Do a lot of there's quite a lot of things. So that's an exciting new adventure for us, and we're just kind of starting that process now. So we'll see. And we're pretty excited about it. And it's for all of WellSpan, not just York. So we're pretty excited about that. Yeah.
Oh,
Yeah.
many good
Yeah,
things
we are.
coming our way.
Yeah. I mean,
There's anything else that? No. How about you, Gina? Anything else? Nothing else? Well, I wanted to give you something to both of you for being here in my show.
aw.
It's our first show, live show, and I'm gonna give you. This is the Super Rosemary T-shirt.
That's wonderful.
So one for you
Thank you.
and one for
Well,
for
thank you very
Look at
much,
that.
Rosemary.
Super Rosemary.
That's adorable. Thank you. Thank you very much.
Thank
So-
you.
Yeah,
that's
so you can have me all the
That is
time.
awesome.
Then you're here in town.
That's
Okay.
wonderful. Thank you very
Well,
much.
thank you
Thank
for being
you.
here with us.
Thank you.
Thank you.
Yes, and thank you everyone, and I will see you next time. Thank you. Bye.